peptides right now, they've been around for a while, but it feels like they're only becoming mainstream or widely known in the last probably year or two. Can you run me through what are peptides and which one should we be focusing on?
So peptides, we've been using them and some of the older ones for, you're talking 10 plus years. But like you said, over the last couple years, peptides are kind of starting to catch wind. We like peptides. There's 7,000 peptides out there. There's maybe 15 or 20 that, depending on the situation, that really, really make a difference when you actually use them. A lot of them look good on paper. A lot of them look good in lab rat studies. But once you put it to human use, you don't see the results. What I like about them, they are fractions of amino acids that initiate responses to you. So think of them like they're signalers to tell your body to do what it should have been doing. There's peptides to tell your pituitary to put out more natural growth hormone. There's peptides that tell your body to initiate repair response. So think about, if you want to talk about BPC157, when you were young, you got cut, you got injured, you healed really quick. As we get older, we don't heal as fast, or we don't recover as quick, or maybe you have gut issues because we do have BPC in our gut, but not enough that we produce. So that peptide could actually heal gut lining, decrease gut inflammation, and just initiating your body to get back to do it. One of the main ones we've used, there's actually a couple in the growth hormone releasing hormone family or growth hormone releasing peptides, Sermorelin, which we use in the program. We actually use that in the morning to kind of pulse the second biggest pulse of growth hormone, helps lipolysis, improves skin, hair, nails, muscle, body fat composition. So it has a lot of weight loss properties to it, body composition properties. One of the other ones that we do quite a bit of, and it's more towards the end of our program or into maintenance, is Ipamorelin, CJC, or if somebody has an issue with the CJC, we'll use just a plain Ipamorelin. And those basically tell your pituitary to put out growth hormone when it's supposed to be putting out growth hormone. You're just telling your body, they're signalers to get your body doing what it should have been doing. That's maybe not happening as you age. And so the safety profile on a lot of those peptides are probably one of the best I've seen versus some of the medications people kind of resort to. There's peptides as of late in the weight loss world. You got the GLPs, you have Semaglutide and Tirzepatide. Those peptides help your pancreas to put out insulin, which kind of doesn't happen from years of maybe eating too many carbs, getting older, and it just doesn't release carbohydrates the same. Those peptides can actually improve how your blood sugar metabolism works. Plus, they're great for weight loss. We use them in the program to kind of control appetite, help people feel a little more satiated, give them some willpower to stick to the program that they're on, and just create a better compliance to the plan, which produces better results. We do use an AOD 9604. The 9604 is the chain of aminos, but you would think it would be 96 to whatever, because they're short chain amino acids. I think it's 177 to 191 when it comes to the growth hormone chain. It's very similar to growth hormone. It's a fraction of growth hormone, but it helps with more lean muscle tissue and lipolysis. And if you're using it in a state where someone's fasting, you could get the body. So lipolysis is actually the body utilizing fat or burning fat up and releasing it and put it into the bloodstream to be used and get rid of. It's cool where the world's going. There's a lot of peptides out there. I caution, when people use certain peptides, just because there's not enough research, and a lot of them, like I said, look good on paper. But if we don't use certain peptides unless we've seen a good track record with them, a good safety profile, and actually results from them. So we try to be very selective in which peptides we use with what we do here at Nuviva.